This is Dr. David Allen coming to you on the television program, People Helping People. I'm talking with Dr. Kirk Christie, a dear friend, great psychiatrist. And fellow Bahamians, it's so important to know we have a cadre of young psychiatrists functioning now who are just phenomenal. And psychiatric care in the Bahamas is pretty good right now, and particularly when it deals with medications. And this is not so in many other countries, even the U.S. Care has improved. Sandlands is doing excellent work. These young doctors, male and female, are doing wonderful, wonderful work. And I can tell you, the treatment at Sandlands is excellent. And so please, if your relative has to go there, don't fight it, because God has provided for us these beautiful, highly trained and excellent doctors. And Dr. Christie leads the show. And really appreciate all the work you do.
Yes.
When you say that, it seems that you have a great team now at Sandlands.
Yeah, I would just like to extend my deep appreciation to the professional staff of the Sandlands Rehabilitation Center, all of the physician staff, the administrators, and they are proponents for good quality mental health care delivery in the Commonwealth of the Bahamas.
And Dr. Combi has done a wonderful job, right?
Yes, Dr. Eugenia Combi, who is now the current medical chief of staff, she is doing a yeoman service at the Sandlands Rehabilitation Center. She's very hands-on. She has an open door policy, and she is really has deep concern for all of our patients throughout the length and breadth of the Commonwealth of the Bahamas.
Well, do you people at Sandlands, the professionals, do you all feel appreciated by the country?
What I would say, I would definitely like to see more funding made available.
For what?
For mental health services.
Yeah,
and
what would you put the funding for? Better facilities?
For better facilities. As you know, we have an aged physical plant at the Sandlands Rehabilitation Center, and now is the focus to update and renovate more of our older buildings, which house the acute psychiatric wards and also the detox ward and the lignum vitae unit. The lignum vitae unit is soon to be fully renovated, and we're hopeful that we can get funding, adequate funding, to renovate the detox unit at the Sandlands Rehabilitation Center. But of course, mental health programs and mental health centers worldwide are underfunded. The administrators and physicians would put in for appropriate budgets, but of course, we would, as per the central government, we would receive a disbursement, but we still need more money. So I'm appealing to benefactors, philanthropists who are willing to help us. So all of us are in this together. Either we swim together or drown alone. Right. And so I would encourage you to contribute to our foundation, the Public Hospital Authority Sandlands Rehabilitation Foundation. If you have any funds, monies that you would like to disperse, we're more than welcome to receive those funding. Persons experience loss in their life, whether it be the loss of a child through suicide, the loss of a child through an accident, or an NCD such as diabetes, consequences of chronic diabetes, chronic hypertension. So, and there are stages of grief, usually, which are mentioned. Shock and denial is the first stage. Harboring guilt, being able to, dealing with depression also may come up during the grief process, and certainly having a stage where you're able to tell a narrative and tell the story and give the autobiography of your child or the loved one whom you've lost. And then we move into acceptance, the acceptance that the person has gone on, and this is the stage of grief. We have in recent days added another stage called resilience, where you move on from the loss and then you continue on with your life and move on to transcending this loss and grief. And so there's many wonderful articles on grief. Kubler-Ross, you can just Google search, and the stages of grief by Kubler-Ross. I would just like to challenge you to also talk with your immediate relatives, your extended family. Of course, your pastor, priest, or spiritual advisor is very important during the stages of grief and also on anniversary dates. And you may grieve the death of a loved one up until 1 year, post the death of that loved one, or even longer, especially on those anniversary dates which I've mentioned.
Very important, Dr. Christie, because in a small little country like ours,
Yes.
the loss of a relative to suicide could be devastating.
Yes.
We want to make sure we let them know that that really is important to reach out and let us know. You're welcome to call my cell, 557-3172. We can put you in contact with people who can help you. But there is help available to you, and you will need help. It's a real thing. Christy, the other thing, there was some studies years ago that showed that suicides were contagious. If you have a number in a short space of time, it can have like a contagious effect.
Yes.
What are your thoughts about that?
I suspect that that could happen. There's something called copycat. Copycat experiences where persons can have these shared symptoms or even shared delusions. There are states of psychosis where persons can take on the characteristics of persons who are acutely psychotic, shared delusional disorder. Also, there are persons who may be engaged in non-suicidal self-injurious behavior, and we know that that is a strong risk factor for completed suicide. So especially adolescents who are cutting, there may be other adolescents who hear of it and they understand that there is a release of pent-up emotions when you engage in cutting. But the danger, if you're cutting, is that you can nick one of the major arteries, the ulnar artery, in the hand, and you could bleed out, and you can die. And so we would advise anyone who is cutting, burning themselves, bruising themselves, hitting themselves, to seek help. And so the first modicum of help is with speaking with your primary medical doctor, and your primary medical doctor can refer you to see a psychologist for talk therapy, and based on the severity of symptoms, you can be also referred to a psychiatrist who can help you, especially if you are having a desire to cut or just preoccupations with cutting. A psychiatrist can help you through medication management and also cognitive behavioral therapy, interpersonal therapy, more intensive talk therapies to help you if you're having preoccupations and engaging in these self-harming behaviors.
Now, doctor, in the old days, there was some kind of stigma attached to suicide too. How do we deal with that in our culture?
Yes, yes. The ongoing issue, it will continue. There is stigma as it relates to suicide, and certainly I think a part of it is that persons have to understand that this is multifactorial. A person who completes suicide, there's a multifactorial basis of why that person completed suicide. It's not clean cut. There's also the lack of crisis intervention or even a basic intervention. And we oftentimes would put persons down if they're having issues. And I would just like to encourage all of us, if you have a loved one who is stating that they want to hurt themselves or they're having preoccupations with self-harm, to have a heart-to-heart conversation with that person. And there's something called empathic listening, listening without passing judgment. Dr. Allen has always talked about it, empathic listening. And, with respect to our daily lives, all of us are so much in a rush, and we really need to take time and talk with our loved ones, and sometimes talk with acquaintances and ask them, how are they doing?
Yeah.
How is life coming on for them? How is your mood? Are you experiencing anything unusual in your life? Even to this day, sometimes I'm delayed coming from Sandilands to my private practice. I'm talking with staff on the grounds of the Sandilands Rehabilitation Center, and we get into some personal moments. But I don't mind being delayed. If I can help someone at work, whether it be one of my colleagues, whether it could be one of the ancillary staff, I do so. So I think all of us have to stop being busy, looking at our phones, looking at our watches, but take time and really talk to the people around us and make a difference in our communities, in our homes, and the wider community at large.
Really important, because things happen. Life is wounded. It's beautiful, but it's also wounded. And if your family is going through this, remember, you're not a failure. It's not that you did something wrong. Suicide is a form of death, and people die in medicine and other fields as well. So it's really important that let's stick together. We need each other, you know. We can't live alone. And so we're reaching out to you today to say, please, if you sense you're going through a difficult time, or you've gone through a suicide in your family, it's not the end of the road. Come forth, let's talk about it, we can work it through. You can work it through and come to healing and get your family together. But it's really important to recognize we all need each other. That's the whole point of community. People supporting and helping each other. Kurt, are you encouraged? Because you see a lot of pain in your work.
Yes, I'm encouraged very well. I believe that I'm in the right place at the right time. I chose the right profession.
You have a wonderful spirit about you. What encourages you?
I think it's my upbringing, certainly one of service. I remember my father always inculcating service above ambition. And so I'm very pleased to help my fellow man. I grew up on the Family Islands where persons were very altruistic. The Family Island physicians were
Your dad was a
modern
great
physicians.
example to you, your father.
Yes, the late Huntley Christie of
How was he?
Andres.
Yeah, what was special about him to you, for you as his son?
I think he was my hero. Well, I know he was my hero, and his work ethic was exceptional. And he was very concerned about the people of North Andres, and he was very altruistic and a consummate professional.
Having come from the Family Islands, do you feel we're doing enough to get the help out there for them?
There needs to be expansion. I'm happy with the Mental Health Global Action Program that we have instituted with respect to Sandilands Rehabilitation Center collaborating with the Department of Public Health and the Ministry of Health. But I would like to see further expansion of the Mental Health Global Action Program. And I would just like to make special mention of Dr. Nelson Clark, Ms. Catherine Weish, and also they were the first proponents of it, and other administrators of the Sandilands Rehabilitation Center who made the MHGAP program an excellent thing and also a great success in the community.
Right. And Dr. Clark is now at the prison?
Yes, Dr. Nelson Clark is no longer with us. He's at the Bahamas Department
But that's
of Corrections.
important too, the prison, right? Because these gentlemen and women up there, they suffer from depression as well.
Yes, and so with respect to the prison population, we know that there's high comorbidity of prison inmates with personality disorders and major psychiatric disorders such as depression, schizophrenia, drug addiction. And we know that certain personalities disorders are a great risk factor for completed suicide, such as borderline personality disorder, antisocial personality disorder, or mixed borderline and antisocial personality disorder is a risk factor of completed suicide. So I applaud our colleagues over there, Dr. John Dillett, Dr. Nelson Clark, Dr. Sean Knowles. Certainly they're doing a yeoman service over there in their collaborations with mental health services, medical health services at the Bahamas Department of Corrections.
Dr. Christie, do you think we have enough ancillary personnel working in the mental health field to help with the needs of our mental health issues?
We need more psychologists, and certainly we need more social workers. And so, yes, there are human resource
Well, social
management
services seem to
deficits.
be really burdened right now.
Yes, there are a lot of demands on our social workers now, and they've had losses at the Department of Social Services through normal attrition. So we really need more social workers, case aid workers currently.
We're going to take a break and be right back.